Welcome back, everyone. This is Paula Van Gilder with Talk with Paula, mental health and addiction advocate. Again, I had shared last week that I was bringing in Will Hunter this week. I'm sure a familiar face to many. He's a huge advocate. He's also very hands-on. He's an ear, he's a voice to assist with a very broken system we have. You always say, I always hear from many people, they have to want to get help. I said, how can you get help in a system that's broken? Because basically what I'm seeing is Band-Aids slapped on everything. I had the pleasure of getting introduced to Will, which I've shared many times with a young lady that reached out to me during the flood, and she actually overdosed, and I met her 2 days after she overdosed. And then I got friendly with Will. He contacted me over something beautiful she had written. And since then, I want to say thank you very much for coming, Will, because you're awesome. I feel we've never met personally. We've chatted on the phone. We've emailed. He has helped huge with many things. A court case that I was working with somebody in, huge advocate, and he is nonstop. Prime example, he was working on things today. So as I was just sharing with Rebecca behind the scene, he's if we could multiply him by a gazillion would be exactly what's needed, because the problem is in mental health and addiction, there's so many breaks and so many avenues, but you don't have the proper channels to help. You have someone like Will, you have someone like me, but there is so few people that want to lend a hand and basically go like this. I can be on the phone with Will and he'll be like, hey, Paula, I'm going to go pick so-and-so up that's going to go into a new home or what have you. So I'm not going to take the floor today. I'm excited to have Will. He gets it. He understands it. He works it almost daily. And I just want to say thank you, welcome, and I appreciate you coming. So have at it.
Well, it's interesting when you talk about a broken system, and you talk about what you mentioned a few minutes ago about people saying, well, people need to want it. If you read the article today in VT Digger about the disastrous Vermont motel program, which has got to be one of the worst run programs in the history of anything that I can think of, there are hundreds of people this week who are being turned out because the time's up. The legislature passed a limit on how many days you could be in the motel, and if your time was up, you got to go, but maybe you could get a room, but you need to call an 800 number and be on hold. And if you read the article, it seriously says this, people are on hold for an hour and a half, 2 hours. Now, something is profoundly wrong if the most vulnerable people in our system are being told, gee, we'd love to help you, but you got to call this number and be on hold for an hour and a half. Mm-hmm. Now, just down the road, there's a telephone company called VTEL, and whatever faults they may have, if you call VTEL, your call gets answered on the first ring. I don't know how they do it, but they do it, and the state of Vermont could figure out how to do the same thing if they wanted to. The problem is, we live in a state that pats itself on the back all the time about how progressive we are and how we're a national leader in this and we're a national model in that. And we're not. If we're a national model in how we deal with mental illness and addiction, God help the rest of the country. But the fact is, we're not a national model. We're pathetic when it comes to certain things. And I'll give a couple of examples. One is inpatient treatment for substance use disorder, for addiction. We have two places in the state of Vermont. One's called Serenity House, and it's over in Wallingford. And the other's called Valley Vista. They actually have two locations, one for men in Bradford and one for women in Vergennes. These places, which may have started at a time when addiction treatment lasted a little bit longer, but right now, you're lucky if you're there for 14 days. And if you go in on a Monday afternoon, you probably are going to get out the following Friday morning, so that you're not even there for 2 weeks. But their attitude is, well, not much would happen over the weekend. So I've talked to people who have been in treatment there and talked about people who've come in who've been in the throes of withdrawal from their addiction, who for the first 3, 4, 5 days they're there are physically miserable. They're not getting anything out of the treatment program that is being offered. And then at the end of the 10 days or 12 days or 14 days, whatever it is you stay, many of these people go right back to the environment they were in before they came to treatment. That may be that they're sleeping on a couch in a crack house. It may be that they're couch surfing from place to place to place. It may be that they're in a motel paid for by the state of Vermont. But there's no kind of long-term commitment to working with people. We're strong on saying we recognize this is a disease. Well, if it's a disease and it's a chronic disease, it needs a lot of long-term planning for how we're going to treat it. And we don't do that. I've gone through so many experiences where I've talked to people I've housed in the past who are in treatment and they're about to get out, and I'm trying to find out what's the aftercare plan. Well, maybe in their garbage bag of belongings when they walk out, they've got something stuffed down in there, but it's not very well understood, not very well implemented. And one of the things that happens when you are beaten down by the system, by your own internal demons, by all the things you're struggling with, is you don't engage in a lot of really good long-term planning. You're going from day to day. If you're struggling with trying to get enough food to get through the day, or God forbid, struggling with getting enough dope to keep you from getting dope sick, you're not thinking about, well, what's my 1 week plan and my 2 week plan and my 6 month plan and my 2 year plan. You're thinking about, how am I going to get through today? And that may involve, who can I steal from so that I can have enough money to pay the dope dealer so I can get the bundle of dope to survive today? And if we don't think about how the world looks through the eyes of the people who we're talking about, we're going to get nowhere in trying to make things any better. A metaphor, I'm always searching for the right metaphor. One of the metaphors I think about is that many of the people we're talking about are in a pit that is so dark and so deep that they can't see that there's a ladder on the other side of the pit that they could start climbing out of. We like to think, well, there's an 800 number you can call.
Yep. Bullshit. Sorry.
And just parenthetically, who is the person in state government who's allocating money still to pay for 800 numbers? Nobody pays toll calls anymore, but state government is still shelling out a whole lot of money so that we have 800 numbers. And doesn't anybody stop to think and say, why are we doing that? And that's just one example of hundreds we could come up with of how behind the times we are and how we're not thinking about what is the real situation in September of 2024 that's facing the state of Vermont. We can pat ourselves on the back about things that we did that were groundbreaking a few years ago, but right now we're not breaking any ground. We look down our nose very often at New Hampshire. We say, oh, New Hampshire, backward state. Well, in New Hampshire, they've got an awful lot more options if you're coming out of treatment to live sober living environments, communities where you can live and maybe work and have people checking on you and encouraging you and helping you along the way. We have almost nothing like that in Vermont.
Yeah.
And when you look at the people who go to treatment at Valley Vista time after time after time, and I know people who've been 2, 3, 4, 5, 10 times, and they go right back to the same environment they were in before, the same situation they were in before, and guess what? It doesn't take. So we could do a lot, I think, thinking about what do we do every day for the people who are struggling with addiction, struggling with mental illness. Many of these people who've been in the motels have been people who are mentally ill, struggling with addiction, and we've spent a ton of money putting them in very often pretty crappy motel rooms and not really giving them much in the way of services. A lot of the people from Springfield got placed in a motel in Londonderry. Well, there's no public transportation from Londonderry, so they were pretty isolated. They might have been able to get Medicaid rides, and that costs a fortune. But the way we're doing it, you talked about Band-Aids. We have very expensive Band-Aids, and we apply them quite a bit, and they don't last, and they don't cure anything. And the people are back with the same problems again and again and again. I spend a lot of time thinking about the criminal justice system, and the criminal justice system is clogged with people who are there because they're mentally ill, they're addicted, and they're poor. And instead of trying to address the underlying causes, we address the fact that this guy 2.5 years ago stole a catalytic converter. Well, if he was doing it because he was addicted, probably the day after he got caught, he stole another one, and the day after that, he stole another one, or shoplifted. And you can read court dockets and you see the same person with 5, 10, 15, 20 pending cases, because we look at each one of them kind of with blinders on, that this is an isolated incident, and we're going to figure out, we'll give him a lawyer, and we'll have a lawyer paid for by the state, and we'll have a lawyer who's called the judge adjudicate this case ultimately, maybe in front of a jury. We're not looking at why did the person steal the catalytic converter to begin with. And very often, because the probation department gets tired of dealing with some of these people, the court system doesn't really want to deal with them, they just do whatever they can figure out to get rid of the case and move it along. And that person isn't any better off, and they're back in front of the court again on another charge. One of the things, and I'll probably offend a lot of people by some of the opinions that I have here, but I don't mind.
I like his opinions.
One of the things that is kind of crazy is that we have mental health agencies who, if you miss a certain number of appointments, they close your case.
Yep.
Well, if you're really depressed, or you're really anxious, or you're really addicted, you may very well miss several appointments.
Yep.
And if you don't have somebody who gets in their car and goes to try to find you, but instead checks off the boxes and says, well, you missed 3 appointments, we're going to close your case, you've got to start from square one. It's like the chutes and ladders game that kids play, where you're almost up there to the top and then you hit one of the slides and you go all the way back down to the bottom again. And we have this kind of punitive attitude within agencies that ought to be helping. I'm not suggesting that people shouldn't be responsible, they shouldn't take responsibility, they shouldn't be held accountable. But that's very different from saying, you screwed up, we're now going to wash our hands of you altogether, and you've got to start all over again. You got to do another intake, you got to do another this, you got to do another that. Well, sometimes people who have mental health and addiction problems went through some pretty lousy stuff in their life. And having to tell your story all over again to another well-meaning new person who may not be there for your next appointment gets kind of old. And at some point, some people say, you know what? I think I'd rather do a bundle of dope than go deal with that stuff at the mental health agency. Self-medication is something we talk about a lot, that people who have struggles inside find that for a few minutes, getting drunk may make their troubles go away. Using crack or using fentanyl or whatever the substance may be may make them feel great for a few minutes. It's no solution, but a wise candidate a few years ago in a debate said, we have to understand that we have a drug problem because for a lot of people, their life sucks.
You just
And
nailed
if
it.
we're not doing something to make life look better for people, we're not going to solve the drug problem.
Yeah. And actually, something you just said, literally, I'm like, I just want to go, yes, because you're nailing, you know how I feel about stuff. You're spot on about everything. And the problem is the chutes and ladder. I'm a very visual, and it's true. You get to the top, you're in a bad depressed state, and you're like, oh shit. And then you're like brushed aside. And that I'm like, oh my God. And I think about so many people that don't have a good advocate for them. I'm an advocate for a few people, family members. I'm grateful. I may annoy the shit out of them, excuse my mouth, but I'm there. You advocate for a lot of people. You and I have been on the phone. You're like, Paula, I don't remember, I think it was a medication one time. Somebody had to get to a certain place one time. Then somebody was leaving a facility, was going to go into some place, but didn't really realize what he was doing. And another thing, nobody is that like that person to keep up. And then this is the comment that I hear, and I'm sure you hear it too. Well, there's not enough staffing. This person needs a team. Yeah, there's a lot of people that need a team. When I started doing this mental health and addiction, I started with a page, and I actually came here, and I know they flashed that thing before. It was probably right around COVID. And I said, if I can just reach one person, I've reached about 110. And that's huge because I know what I'm doing. People are out there listening. And yeah, I will fight for you. I will be your voice because it's hard when you're tired, you're depressed, you're feeling foggy, like crap. You may have medical issues. You don't see what I see. You know I'm like a note taker. I have calendars, blah, 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 but not everybody is like that. You're just on survival mode. You nailed it. A few things you said, I literally was like, I didn't want to yell, but I'm like, yes. So anyways.
Well, one of the things that we lose sight of is that we can create a program with a 30-page application that some people who don't need it can look at that application and go right through it and fill it out and no problem. But the people who we're really trying to help very often look at a 30-page application
Overwhelming.
and they say, I'll do this another day.
Yep.
Part of the reason we've got such a homeless crisis is that getting into public housing is a nightmare. It requires all those forms to be filled out. You've got to have references from all the landlords over the last who knows how many years, and people who were homeless or maybe incarcerated or maybe institutionalized, they've got gaps in their They don't really want to talk about those gaps, and so they kind of put the application aside and they don't go back to it. I dream of having a little cadre of people who are good at filling out forms, who would say, yeah, you lost your food stamps, I'll help you. We'll go get them back for you. I can't tell you how many people who I deal with who are on SSI, that's their entire income is a little under $1,000 a month, and they get food stamps. And every so often the government needs to get an update. Well, the government already knows how much they're getting because the government's the one giving them the SSI, but they still want to have them fill out a interim report, they call it. Well, the interim report is just, to make sure they didn't inherit $1 million last month, that they maybe don't need the food stamps anymore. I can guarantee you, if they inherited $1 million, they're not going to worry about getting the food stamps next month. But a lot of people who are depressed don't open their mail, and they get some piece of mail from economic services, and they don't open it. And then it turns out that that was the request that they file an interim report. And so they didn't do it. And so all of a sudden they find they don't have any EBT benefits this month because they didn't do this. Well, how long should it take government to fix that problem? Really shouldn't take very long at all.
No.
But how long do you think it does take?
Oh, 6 months, if not more.
And people have to fill out forms and then be interviewed over the phone. And a lot of the people I deal with, they change phone numbers as quickly as some people change their bed sheets.
Yeah.
And so maybe they filled out an application and they put down a phone number that is ancient history now.
Yeah, or an address that doesn't even exist.
Or an address that doesn't exist anymore.
Yeah.
But what I would love to see a group of people who I could call up, or you could call up, or somebody out there in the audience could call up and say, I don't know what's the problem that I can't get my EBT benefits back, or I don't know what I would
like
need to do.
Like a call center type of thing.
Yeah, well, something, not where you wait on hold for an hour and a half.
No, a real human.
But a real human, or a real, and somebody who sees you as another human being and wants to help you and wants to appreciate the fact that you're a valuable, precious human being who needs help at this stage of your life. But we don't do it that way. If you walk in, I've mentioned before, you call the Economic Services toll-free number and you're told there are 62 people ahead of you.
Yeah.
And then you listen to dreadful music, and if you're lucky, you don't get the call dropped, but a little bit later they'll tell you, now there are 58 people in front of you. And then there'll maybe be a recorded message about your call is important. We appreciate your patience, and a bunch of other lies. And eventually you get somebody, unless it gets to be 4:30, in which case all of a sudden the call drops altogether. But you get to somebody who is trained in how to say no. They are really good at that. No, sorry, we can't help you. We can't do that. We can't do this. Let's try to see people as human beings. Let's try to see them as the individuals they are. One of the reasons that I say the motel program is atrociously run is that there are people who have managed to get themselves free hotel rooms, even now in the time that things have gotten much, much harder, who really should not be a priority. People who are fairly young and able-bodied single individuals who the state has been paying for a motel. And I know, I can give you citations to individual cases because I know these people and I know the situations. But I don't think that the way that program has been administered, we've been thinking about the individuals and seeing them as individual human beings. We've been saying, well, somebody scored their application and they got 9 points and they only needed 7 to whatever the criteria might be. Well, unfortunately, sometimes people lie and they fill out forms incorrectly. Maybe on purpose, maybe inadvertently, but unless you see them as human beings and understand what their real needs are, you're not going to get anywhere. You're not going to solve anything. And we don't, the people cycle through the system, and they, the idea, the dream that I think used to be, I'm 70 years old, probably 50 years ago, there was an idea that anti-poverty programs were to enable people to move out of poverty. Now it seems like there's just kind of an acceptance that, as Jesus said, the poor are always with us, and that the poor are always going to be with us, and we can't do anything different about it. The bad thing is that in Vermont, at the same time that state government has been so lackadaisical in dealing with fighting poverty, the cost of housing has been going through the roof. Partly because of COVID, partly because of telecommunications. We are now the potential home to a lot of well-paid working people who telecommute. And they can be buying houses with income that's New York income, and they're competing with the people on SSI. Well, they're not competing because the people on SSI aren't going to be able to buy a house.
Right.
And so we're condemning them to a life of perpetual renterhood, and
Which the rents are going crazy.
rents
too.
are going crazy, and rental properties aren't available anymore sometimes because the people have decided they're just going to sell and cash in.
Yeah.
So Vermont's problem has gotten a lot worse because while we've been standing still in addressing these problems, the economic factors have been getting less and less favorable to the people at the bottom.
Yeah.
And it's really shocking that Vermont has such a high rate of homelessness.
It's sad. It's really sad. It's really, I'm sure you deal with it. I didn't mean to interrupt, but when you drive around, at least me, I was in Rutland. I did a monster truck thing this past weekend for our hot sauce. I don't go up to Rutland a lot, but the stuff that I saw, I was like, what's going on? Yeah. And I didn't realize there's a whole community behind Walmart in Rutland. And that scared, it broke my heart because to see the lifestyle, and you just nailed it prior, they go into survival mode. So it's like they're chasing that high because right now they've got this whole little community where they're all doing the same, but you know what? They're all accepting each other. They're all okay with each other because they're all on the same page. If society, and correct me if I'm wrong, didn't just keep looking at them or walking over and maybe was more involved, that's what I emphasize, Will.
Well,
I feel more need to get proactive.
Yeah.
There's a lot suffering.
One interesting idea that I've had recently is to think about telling every community, you've got to have some responsibility for the people we're talking about.
Yeah.
We don't let some towns say, you know what, we're not going to have public schools. If you live here, you're on your own. No, we say that every town has to provide a free education to the kids who live there. Maybe they don't have a school, maybe they pay tuition to someplace else, but you don't have a situation where if you move to this town, your kids aren't going to be able to get an education.
Right.
That's a requirement every town has. Well, I think we should think about a requirement that every town should have to take some responsibility for poverty and homelessness and addiction and mental illness.
Rock on. I agree with
because
you 100%.
Right now, you have some towns who knock themselves out to have shelters and to have social workers and to have a police force that's trying to work with people in a positive way. And you have other towns who say, oh boy, I'm glad that doesn't happen in our town.
Yep.
And I'm not really sure we should allow that to happen.
I agree. Actually, I was talking to Sammy, not sure if you can hear me, but I actually am working with a couple officers that want to get involved in stuff now. And that's huge. They're two, one of them is Sergeant Warfel and Officer Foote. And she actually is so proactive with let's do something. And to me, that's speaking volumes. Actually, she's going to come on in a couple weeks. But finally, and I agree with you 100%, it can't be brushed under the carpet anymore. I mean, maybe not this area per se has a ton. People don't come out with a sign that say, hi, I'm struggling. Hi, I'm a recovering addict, and I have severe depression and anxiety. People don't put like a sign up. Do you know what I mean? But there's a lot of people struggling. And I see literally, when I mean literally, I see from little kids to adult, like older adults. But the problem is, if you mention you need assistance or help or whatever, there's such a stigma that's attached, and it drives me nuts. Excuse me, Will, because I have potty mouth sometimes. But it just, I get so irritated because I'm like, what is wrong with you? They are just, they're not any different. A good majority of people, and especially that I know, come from good families. Got lost in, you know, there's a reason why people don't wake up and say, oh, I'm going to, you know, get up this morning and I think I'm going to shoot up, or I think I'm going to do this. No, a good majority, and correct me if I'm wrong, because I know you talk to a lot, they have a history. They have a history of abuse, neglect, and it sucks. And,
you talked about the stigma, and it reminds me of a woman who worked in the court system back when I was practicing law, and she had been out for several months, and I saw her one day. I went into court and she was back, and I said, nice to see you again. What happened? And she said, I had a mental breakdown. And it took me aback a little bit, and she said, she said, I have been thinking about coming in here and wearing a bandage around my head, because then people would say, what's the matter? You come in here with a cast and people say, oh, what happened to you? Well, mental illness is illness too. And we ought to be able to
talk about it freely.
Openly. The fellow who was the sheriff in Windham County up until a few years ago checked himself into the Brattleboro retreat. And he was very open about it. And he talked about the fact that he was suffering from severe depression and was feeling suicidal, and he needed help. And that was a wonderful
Well,
thing.
Ryan Palmer, I've had on here. And Ryan's awesome. Ryan is he's actually everything that Ryan talked about when he wanted to, run, he's actually doing, which I'm like, awesome. Because he knows how I stand with this, how vocal I am about this. And I think that's one thing that I did when I started this. I'm like, I started because my brother, older brother, he's passed away now. He was a psych major at UVM, 4.0 grade point average. You're familiar with Burlington. He thought he could fly off the water tower up there. We found out he had, schizophrenia, blah, blah, blah. And then I myself I've battled depression and anxiety. I worked really hard. I went through postpartum. There's a lot of things, but I'm very open about it. I'm not ashamed. And that's the thing is, if I'm not ashamed, and I said, because I was the girl, and I said this in one of my first shows that I did, I was the girl that you would have looked at down the street and be like, God, she's got a nice house. She's popular. This, that, well, that's the image, but nobody knew, because back in the 80s, good Lord, you honestly think you could, I suffer from severe depression, and you just couldn't do that.
Well, I think that one of the great truths that people need to learn is that there's no family that's not touched by the issues we're talking about. I can't tell you how many examples I can think of right now of people who I thought for years, boy, this family was just the perfect family. And then you get to know them a little bit better, and you find out that the first husband killed himself, or somebody's in jail, or somebody's an addict, or and the only way you're going to move forward is by talking about it openly and
Yeah.
not just saying, well, we don't talk about that. But I've often said to people who I deal with who are at the bottom, you know, don't assume that that person on the other side of the
Has a
desk
great life.
has a great life.
Yeah.
That guy who's interviewing you today may have been told that one more screw up and he's getting fired.
Yep.
His wife may have just left him, and he may be looking forward to the end of the day so he can get drunk and not, you know, he's not somebody who
Yeah.
you need to be feeling intimidated by because he's got everything perfect
Right.
and you don't. But you know, ultimately, we need to understand these are problems that we've got to look at the same way you would hope in a good family you would look at. This is our family.
Yeah.
And some people are homeless, and that shouldn't be.
No.
And some people have medical problems that nobody's paying any attention to, or mental health problems that nobody's paying attention to. That isn't a way to live, especially in a country that's as well off as our country is. If you saw a family where the parents had fancy cars and went on nice vacations, and the kids were left to suffer hungry and cold while the parents were gone, you would say that's a terribly abusive, neglectful situation. But we live in a country where we accept that. And we need to be thinking about another way of doing this.
No.
And you know, the final thing is that it is really, really expensive to do things the way we do them now.
Yeah.
I can't tell you how many people don't have a primary care doctor, so the only time that they can get medical care is going to the ER.
Yep.
And a lot of them don't have transportation, and they don't have friends who are willing to drive them, so they call the ambulance. Well, I've looked at the bills that the Springfield ambulance issues. It's pretty expensive to take an ambulance ride to the hospital.
Yeah.
One of the things that we need to be smarter about is, again, I'd love to have a team of people who are available. Somebody gets a call at 9 o'clock at night saying, this guy needs a ride to the hospital. Are you willing to do it? And then maybe that person signed up to do that a few nights a week or something. And not only does that save the money that would be paid to the ambulance service to get the person there, but it's a caring fellow human being who's coming to give you a ride and make you feel that you're not just a client.
Yeah.
You're
human.
Another human being who needs help.
Yep. Oh, I'm on board with you. So let's plan that. Because I, you know, like I said, when I met Will, what was I talking to you about? I remember I said something one day. I said, Will, I want a house. I want a house that's a structured house where people can live, and what we had chatted about. That's my goal still.
Yeah.
But I want to do what you're saying because I know there's people that want to help.
Right. There are all kinds of group living situation that if we were smart and we had a little bit of money to do, that would make an awful lot of sense to do. One group is usually women who have made some mistakes and the state has taken custody of their kids and they desperately need to start getting their lives in order so that they can become parents again. There ought to be a place for a few of them to live together with help, with counseling and support. I've mentioned before, people coming out of rehab who need to keep building on the work they did for the 10 to 14 days they were in rehab, need a place where sobriety is celebrated, not just in a brochure, but around a dinner table.
Yeah. And even on the days that they're feeling like crap, where they're like, ugh, that's when, because you made a good point, when you go into rehab, the first 5 days, you're coming off being sick, you're getting the bare minimum, the what is the word I want to say, the standard protocol, the how the guidelines that they have to follow, and then you're out literally in probably 4 days, just as you're starting to wake up and stuff, and then you're like, oh, you're back on your own. No. And I don't agree with sober living houses, because from what I'm hearing, and I've asked many about this, you actually get a lot of drugs in there.
Well,
So
it depends how these things are run. My experience with group living for vulnerable populations began with Dismas House in Rutland, where I was a volunteer when my son's now 30. When he was about 5 years old, we started going there twice a month to cook an evening meal and share it with the residents. And that was a place where people came, and it remains a place where people come after they get out of jail, where every night they sit around a dinner table eating a meal together with volunteers from the community who've come in to share the meal and share their time. And in a wonderful, quiet, gentle way, it gets across to people, you are really valuable.
Yeah.
You are fellow human beings, and I, a banker or a judge or whoever it might be, has chosen to come in and share a meal with you tonight because that's where I want to be.
Yeah.
And that is a wonderful message to
I
give
think that's
people.
a great idea.
But I think that, sure, there are sober living places where there are some states where it's become a big business and people make a lot of money, and some of them probably figure out ways to charge insurance. But I'm talking about figuring out a way that people can learn from each other, be supported by each other, help each other along the way, not live in isolation. One of the worst things, if you're talking about mental illness or if you're talking about addiction, being isolated. And so many people I know on even a beautiful day like today, instead of being outside mingling with other people, they're sitting in their rooms with blankets over the windows in the dark, physically and metaphorically.
Yep.
And we need to tear the blankets down and say, look,
and hold their hand
and hold their
let
hand
them
and
know
say,
that it's okay and you're not alone.
It's a wonderful world.
Yep.
It's got all kinds of problems. It's got all kinds of disappointments. It's got all kinds of frustrations, but it's still a wonderful world, and we're lucky to be here.
Yeah, but a lot of people, I mean, I agree with that 100%, but a lot of people don't have that, which stinks. So if we could get more people together, that will help take down the blinds, to show them trust. Trust is a huge thing. I hear this often. Many people in recovery, mental health, addiction, it's trust. Their trust has been broken. So they only know one thing is to feed and numb.
Yep.
And that sucks.
Yeah. Well, the other thing that I think is a real problem is that people get the idea that they need to project what I call an aura of competence.
Right.
That the person who really needs help goes in, and some nice middle class person on the other side of the desk who doesn't really understand their situation is asking them about stuff, and they don't want to say, actually, I don't know where I'm going to stay tonight.
Sure.
I haven't eaten in 3 days. They want to make it sound like they've got their act
Everything's
together.
good. Yep.
And we need to tear down those barriers between us so that people can be frank about what their needs are and talk about where they need help, because we all need help. You know, I've said this to people. None of us came into this world able to stand on our own 2 feet and take care of ourselves. And most of us won't leave this world without needing help.
And some of us are stronger than others. Some
And
of us
there's
are
nothing
fighters.
wrong in the times in between those two ends of life to say, I need help. I can't do this on my own.
No. I mean, I sure did, and I'm grateful. Like I said, you can portray an image, but then when you're finally like, I really need to figure some stuff out. I need to address some issues and to be a better person, to deal with certain things. And when I did, it was like such a huge flip on my life. And I'm grateful every single day that I did that. And this was back when I was like, what, 20, Jeremiah was just born, so I was 26. And best thing I did. So, you know, I'm grateful for you. You got me literally while you're sitting here. I'm like, oh, that's a great idea. That's a great idea. Thing is, the best thing about Will and I, we, like I said, this is the first time we've met, but we've been on the phone. We chat, we throw things off each other. He's helped me with a few things, actually several things, putting me in contact with the right people. He's run stuff by me. He writes beautiful things, you know, for, you know, articles, for emails. I mean, he's so proactive. So I don't know if there's more that you wanted to say, but I do need to say to you, I've had many interviews on here, and this is probably the best because you literally nailed everything that I try to emphasize all the time. And
well, thank you for doing this. I mean, it's wonderful that in the world of public access that topics like this can be discussed, and people sitting at home can know that they're not alone, and that the problems that they're looking at may feel daunting, but they don't need to be overwhelming.
And you're not alone. At least you got Will and I, and also other people, because the more I'm chatting and being honest and open, people are like, wait, I want to get involved. Or Paula, I've gone through this. I know what it's like to do this. There many, actually, how I met one person that started is they reached out to me and said, Paula, I'm an alcoholic, I'm this, and it's like, wow, I didn't know that. But the thing is, I mean, we all struggle with something. And as I close this, I want to thank Will. Whatever you're in part of your life right now, if you are struggling, my name's at the bottom, Will's name is at the bottom, and Will is a huge advocate. I honestly say, I always think I do a lot. No, this man's sun up to sundown, on the road, helping people, giving rides, grocery shopping, doctor's appointments, you name it, he's doing it. I'm grateful that we got connected. I'm grateful that you came on. You know, I did hear Turning Point is a 20-year celebration. I do know they offer some type of smart recovery, all recovery, seeking safety, morning meditation, emotional sobriety, which I think is wonderful. They're doing a big barbecue in Springfield this weekend. You know, check it out. I was talking to Dave and my husband, and I think we're going to just pop down because I have had Tesa on here, and I had Sleep in Heavenly Peace, which is from North. I know people have seen them, but they build the bunk beds for a prime example. This is how other people get involved. They build bunk beds because many kids have gone into foster, or kids are just getting back with their parents that because of addiction, mental health, and need to get off the floor and have new beds. So I want to thank you for joining. Not sure if Will has anything more to say, but feel free to reach out to me or Will, and that's good. And thank you.
Thank you.
Have a great day. Bye.